Downside.
I mean, you've talked a little bit about advancements in your field, but what other big advancements have happened in periodontics in recent years?
So I would say, I mean, there's been quite a few, but I would say the most exciting one and the most recent one is probably guided implant surgery, which is really, really fascinating. So, we can have a patient have a CT scan, and using computer technology, we can import that CT scan into the software, which allows me to pre-plan the positioning of the implant for that particular individual. I can also import, images like photographs and images or 3D scans, so that I can pre-plan everything in a three-dimensional manner. So there's a lot of work on my end, kind of behind the scene, but on the day of the actual surgery, my plan is set. So everything is already planned. All I have to do is put the implant in, like GPS. It takes the guesswork out, and implant positioning is probably around 11 times more accurate. So I would say that's probably the most exciting new kind of addition to our field.
Back, 20 years ago, we would use a two-dimensional radiograph and basically eyeball the position of your implant. Using, like you're saying, the CT technology and 3D technology, because you can 3D print these guides, it takes the guesswork out of it, makes it almost foolproof. And for the restorative dentist like myself, I'm very appreciative that the implant is where it's supposed to be, planned exactly how we want to place whatever type of crown we're going to place. Because I still recall when we first graduated from dental school, I tried to restore a couple implants that were placed on a really difficult angle, and it required a lot of jimmying in order to even get a tooth onto it. And it's definitely come a long way for sure, especially in the last 5 to 10 years.
Absolutely. And I think the key to successful partnership between the different kind of specialties and not even in dentistry, but in any field, is just working well together. And this new technology allows you and I to work really closely together, because you can tell me what type of crown you're planning to do, whether it be cement retained or screw retained, what size roughly, and I can plan that in and work backwards. So I know what size, type, angle implant I need to put in what particular position. And once I have that decided on and positioned, then I know, do I need a bone graft? So that, do I need to create bone? Do I need to create gum tissue in a specific location so I can put that implant in where it belongs, where it needs to be, so that it's placed in a prosthetically driven?
I think that's the key, is a holistic approach. And a lot of times in what we do, especially when we're doing sort of larger treatment plans that involve treatment from your end and treatment from my end, that planning and that treatment planning is so important, and having all the information in front of us, having it so we can look at it in a very sort of holistic type of view, will determine the success of that case.
Absolutely. And I think a lot of communication is important, so you can get that good outcome. And that's key.
Yeah. And I think that's the one thing that I am very thankful for in our working relationship with your office, is that communication is always there. We always know exactly what's happening from your end and vice versa. And that way nothing falls through the cracks. And I really appreciate that.
Well, thank you. I mean, obviously that feeling's mutual. I feel the same.